Hey guys, welcome back to my channel. My name is Amilas. I do nursing videos, vlogs, challenges, videos like this. If you're new to this channel, don't forget to like, share, comment, and subscribe. And if you've been here from day one, wagwan people, wagwan. Now, yes, me gone for a month. At this point, I know you guys have no reason to still be subscribing to this channel, but I am not the best at consistency. We're just tired. That's the thing. That's the news. That's the update. So you see the title. You have span coming up. You know what I'm about to talk about. I'm about to share my span experience, as well as giving you guys some tips and tricks and everything that I basically can gather. Now, if you haven't watched the part 1, this was when I was in nursing school. The link will be below this video. I should be popping up somewhere. Go ahead and watch that before you watch this one. Okay. Now time has passed so fast. You guys are getting ready for span, or maybe I think some students have already completed span. I think NCU students have started already, but I know UTech and UE is coming up, and I am so proud of you guys and happy that you actually reached this far in your journey. You're almost at the end. Me know the tired. Me know the tired. Me know the stressed out. But I'm proud of you. If nobody not proud of you, I'm proud of you because I know firsthand how it is. I'm super proud of you and happy that you made it this far. A little backstory for those who are probably new to this channel. I am a newly licensed registered nurse and I'm now practicing. So initially when I left college, I had a job as a nursing instructor. I'm still doing that part-time. However, that's what I went into right out of nursing school, and it was good. It was fun and I learned a lot and I built myself up, and I must say I was pretty proud of myself. I am pretty proud of myself. I left that and I went into the hospital in February. It's June now, so that's what, March, April, May, June, almost 4 months working as a registered nurse in the hospital. And for the last video I put up here, I was working on Male Medical, which is a medicine floor. So a quick update, I'm no longer doing medicine. I am working with females now, and I'm on this surgical floor. So I'm on female surgical. Let's get into the meat of the matter. We're talking about span of duty exam. And what is this exam? Now, this is something, it's an practical exam that nurses complete here in Jamaica in order for them to be qualified to getting their degree. And it's something that you have to do. It's like step 1 of getting your license. So there are 2 steps to getting your license. It's to pass span of duty and to pass written R&R exam. So yeah, that's span of duty exam. Now if you see me looking down, I have a book where I wrote my notes in so I don't blabber all day. For span, you'll have 3 persons with you at all times. You have your teacher, and you have a nursing council representative, and you have a nurse. Yes, you have 3 persons from time to time. Not all the time, but from time to time. So they will watch you do all of your skills and all of that. So first things first, help who is going before you. So when the span date drop, go in your little group, go in your little clique, and you start plan out who you talk to, because I know you don't talk to everybody and all of that, but start feel out who you talk to, who all that, who is going before you. And I went last, yeah. Once at the entire group, I went with the last set. But anyways, for the persons that are going first, we normally tend to go on the word with them, ensure that they have whatever that they need. And this does not go for the person, not only go for the persons in your class. Speak to the UE nurses, speak to the NCU nurses. Everybody is a team. When the UE persons that were at Cornell Regional with me, they had their exams before me, and we went with them, for them. We didn't go on the ward to work. We went to practice dressing, and we went and we made ourselves available. We ensure that there were paper towels. We ensure that their treatment charts are written down. We ensure that the doctors don't steal the dockets. We were just there, ready in case they want something. If they want somebody to send out for something, they forgot something, or if they want a quick Google search on something, we were there. So not just limit yourself to the students that you go to school with. And this is my advice for you students as well, and the NCU students. Help the other schools. There's no competition. But yes, that was the first thing. Help who is going before you. So you're going to make sure that the paper towel dispenser has paper towel. Get the orderly or whoever it is, and let's make sure that them put it in there. Because you know, when you're doing the hand washing, you want the paper towel to be able to drop down so you can do the proper hand washing. Ensure that there is soap. So remember, you know, that there's an asterisk point that that's on the paper that says that you must identify the nearest hand washing station. So if you go one hand washing station, not the day you got the other, that kind of hold up your time. Plus it's an asterisk point. Stick a pin for those who don't know what asterisk point is. There's normally a rubric that's normally circulated around. Ask your lecturers about it, and it shows you everything that you need to cover. So everything for dressing, everything for care plan and stuff. And on that rubric there are some asterisk points, and you are not allowed to fail anything that is the asterisk point. So for example, the asterisk point says that you should report any abnormal findings to a nurse. If you're doing something and something is out of range or elevated BP, don't just write it down and say, oh, they might get them blood pressure medication. Ensure that you say to a nurse, because you're the student nurse, ensure that you report it to the nurse and let the examiners know that you reported to the nurse. It is an asterisk point. For another example is the medication. A lot of things under the medication point part is an asterisk point. So if you miss a step, a check, you miss an asterisk point and it's an automatic fail. It doesn't matter if you get 100 on everything else. All right, so make yourself knowledgeable of the rubric and stuff like that so you can go through. All right, back on track. The next point is do not work full shift the week before. So the week before span, and the sisters and the nurses on ward will be already aware that span is coming up. So I know you guys are out on a rotation right up to span. This is my advice, that you don't do a full shift. You don't go in, receive your patients, all of that. The week before span is crunch time. The week before span is the time that you basically look into yourself and say, what do I need to brush up on? So what I did, and colleagues that I did, we went and we spoke to the sister and asked them if permission, if we can just come in and do dressing. Dressing was a thing where most people more nervous on that, because you know you can practice care plan at home, stuff like that. So what we would do is we'll take a picture of the care plan for all the patients, and we'll go home and research all of those stuff and try to come up with care plans and stuff like that, because it makes no sense you study for one particular patient, because that one particular patient, they can die, they can be discharged, and they basically don't want any students. You get me? So we didn't kind of waste our time, and I put it in this because not everybody can function this way. We didn't work a full shift. Well, I didn't work a full shift. I would go ask the sister permission if I can just do dressing, observe medication administration, or do medication administration, especially the areas that I was lacking in nursing school. I was lacking in IV medication and stuff like that. So that is what I would do. I didn't go and receive patients, and I was stressed out myself the week before, and you'll see why. The next one is to speak to the nurses and doctors. So I don't know what the situation would be like for you. I didn't have autonomy over the patient that I was able to choose. Wink, wink. So what I would do is I would go early, or from the day before, because I was there the day before, and I let the nurse know that tomorrow morning is my span date, and these are the patients that I have in mind. Give them a paper, give them a name, and I ask to speak to the nurse that's coming on in the morning, because it's the nurses that normally pick or give the examiner the exam or the patients. And when they're writing their duty, you know, them write my name for them patient there, so I got them. So I don't really me choose them, but I me choose them. If you get me, I say this is something that I don't really agree with. Why nursing course, they don't want you to choose your patients, but yeah. Anyway, so speak to them. So that's the nurses. Explain to the nurses that I'm gonna need a help. I'm not so confident with doing this. Yeah, I think if you choose a patient, get their opinion. They will tell you, don't choose a patient there because I choose a patient here, I'll give you a hard time. Stuff like that. Speak to the doctors. Let them know that I have an exam. So can you please write the treatment chart? Emphasis on that. Can you please write the dressing order? Because they will write daily dressing. Do not accept that. You need a dressing order. Daily dressing with what? What do you want it to be dressed with? Normal saline alone, betadine alone, normal saline and what's the ratio? 3 to 1, 1 to 1, stuff like that. Some of them will say like, why you need all that? Like, hello, it's an exam and I need it. Pressure them. Find somebody who do it. Alright. So make sure it's the doctor them. Do them part. It's just for a day. Get it over with. Alright. I spoke about the next point is the max span paper. I spoke about that before, I think. Did I? I have brain fog, by the way. I'm just gonna go over it again. I said the same paper that you get in max span might be the same paper. So the same way I have the care plan attached to the back with the assessment, stuff like that. My advice is to get a copy. I'm not gonna come on Rihanna's internet and tell you guys how to do that. Right, figure it out. Once you obtain that copy, practice writing in your care plans. Pre-write your care plans, them the common type, and that's the next point. Pre-write care plans. The common, like you're gonna find acute pain, maybe. I didn't have any of that, but if you're gonna do a dressing, chances are you're gonna have an impaired skin or impaired tissue care plan. Write that up. You're gonna maybe find an impaired physical mobility, risk for infection if the patient has a dressing. Sometimes some persons don't like when I use risk for infection as well as impaired skin because the interventions are the same. But if you can speak for yourself on behalf of yourself and identify why you use it, because for example, yes, the interventions are going to be the same, you know, practice hygienic things, ensure you clean the wound and stuff. But you might have a patient that is not knowledgeable on how to care for themselves. You have patients that cannot identify signs of an infection, stuff like that. You can write it. You can write a risk for infection. You have patients who them just naturally dirty and they like scratch. That patient is at risk for infection. But anyway, some persons like to tussle and to avoid the back and forth because, you know, students, we get the shitty end of the stick. I'm just letting you guys know that some people don't like when you write the risk for infection and the impaired skin. Anyways, the point is pre-write the care plans that you think that you will use. If it's the same paper, then 1 + 1 = what? Okay, figure it out. The next one is don't be afraid to choose the critical patients, and a lot of us shy away from them as student nurses. So why am I going to tell them if you take them up in an exam? Why? Because the interventions for critical patients will come much more easier than a more stable patient. Case where the examiners will be or might be a little bit more lenient on you based on how critical the patient is. So don't be afraid to pick the critical patients because it is easier for you to come up with your interventions and, you know, care for that patient. Most times you're gonna get help. Yes, if it's something that's out of your scope or something that, yeah. I mean, not telling you if you take the one we need like constant monitoring, but don't be afraid to. Yeah, don't shy away from them. The next one is to pick a easy dressing. I know you want to show off your dressing skills. I know you want to do all of that, but come on, people, this is span of duty. You just want to go in and out and pass so you can relax and breathe, because I know a lot of you guys are holding your breath right now as we speak. So you know a patient that did a surgery and they have a lovely suture line. Choose that patient. You know a patient who maybe emaciated and they just starting to have a stage 1 pressure ulcer and it's very small. Choose that patient. Even if the wound is 1 centimeter, choose that patient. Don't be a hero. Don't be a hero. Don't want to take up no stage 4 just because you want to describe the serous sanguinous exudates or what. this is not the time. This is not the time to try and play impress. You know, choose the easier dressing, get it over with. In my experience, I had a stage 1 pressure ulcer. It was a little dot, and that's what I did. It was right in the sacral region, and it was an easy clean. Choose the suture lines, choose the little stage 1 ulcer. Don't take up yourself and pick up no wound where you have to pack and marginalize, and you can't identify which part clean versus which part dirty. Listen, take my advice. Anyways, the next is pick a patient with 2 routes of medication. For those who don't know, because I didn't know in my time, that when you're doing span, you know, you're going to say, make a choose one patient from pure medication, give you 2 Panadol and go. No, you have to have 2 routes, and nobody told us. So it's either PO IV or sub-Q IV, whatever. It has to be 2 routes. And it's easier to choose one patient that has 2 routes of medications. You're already familiar with that patient, you know that patient medication, versus you have a patient with just 1 route and you have to go to another patient where you don't know nothing about, you probably don't know the medication and stuff like that. In my year, my colleagues and I, as I said, we didn't know about this. And it's a case where I know one particular person, they had to come back on a different day to finish up their exam by doing another route of medication. Imagine the anxiety. And I know another case where another person had to go to a whole different ward to medicate someone and stuff like that. For me, my patient only had PO meds, but luckily there was someone else on the ward who needed an IV medication. And this is a whole story in itself, because that patient was a troublesome patient, and the sister allowed me to kind of prepare myself, because I wasn't prepared to, you know, medicate that patient. So I had to go. The patient didn't have any ID band, because me not look at every patient. I was looking at my tool. That patient didn't have any IV band. The IV access was sluggish, stuff like that. And that patient didn't have a treatment chart written up, so I had to be all over the place trying to sort that out. A nurse was there helping me. By the way, she's on YouTube, so go and follow her. She has a nursing series and stuff like that. She's my friend. Go follow her. Yes, so she was helping me and stuff like that, and getting a doctor to recite and access. So I went, I did my calculations and everything in the medication area, and then I went to the patient bedside with my trolley and everything. But when I went, the medication wasn't going. That was the first tussle that the devil was trying to bring. And I was like, okay, staying calm, because remember the examiner is there, she's watching me to see what I would do. But she wasn't intimidating or anything. She was kind of trying to help me, because as I said, I went last. So at this point, they were tired of me, or everybody. So the nurse that was there with me, she went and she called a doctor to recite the access, and that took a lot of try, a lot, because this person, particular person, I don't remember his diagnosis, but I know he had a lot of swelling. So even in his arm, it was just horrible. So it took about 3 tries for me to actually get it done. And yeah, so yeah, choose a patient with 2 routes of medication just to avoid the hassle. Right, so the next point is to call CCSD or wherever that prepares your set. They normally know when it's exam time, and we will normally give them a list of persons and the date that we have exam. Let them fix it. Write a description of how you want your set to be fixed. This all depends on you and how you do your dressing. For me, I wanted 3. I didn't want the little kidney. I don't know if you know that. There's a kidney dish in there with the cotton. I didn't want no cotton in my set. And I wanted the kidney dish. They said that they had to put it in there because I didn't want it in there. And I told them, put it in there, but let it be empty. Right? And I wanted 3 forceps. I wanted the 2 one with the 2 big handle, because my fingers are very large, and in max span I remember I was doing it and my finger got stuck in one of them. But anyways, so I told them that I want the big ones, not the long one, you know, but the bigger ones, and then I wanted the little tweezer thingy, so 3, and I wanted the kidney dish empty, and I wanted the bigger kidney dish to have, and I told them I wanted a lot of gauze, stuff like that. So that's how I made my set. That's how I'm comfortable with my set. So whichever way you're comfortable with it, please advocate and ask them for it, and make sure you call all the time just to find out, especially the day before, if it's made or if it's sent down. And on the day of exam, you can stop before you go on the ward and collect it, or if you have someone that's on the unit with you, like a friend who does not have exam, make them go collect it, stuff like that. Yeah, so that's it in terms of prepping. In terms of studying wise for prepping for span, as I said, you'll have patients that will be leaving, discharging, all them something they're not fit. So I would not tell you to study for a particular patient like the days before span. So what I would do every day, I go and take a picture of the care plan once it is updated, and I try to come home and study like the usual stuff, like the pathophys, the common medication. I didn't go in depth. Honestly, I just wanted to know these simple things like what's going on with the patient. And then I did exam on a medicine ward, and if you know medicine patients, for them cases are some case we have fussy I ate for them, stuff like that. So that's what I did. And like the day before exam, I went to ensure that everything is there and the patients that I had in mind, just to, yeah. So exam day now, of course you're gonna go early, because you're gonna have to go ensure that the nurse, whoever the night shift, tell the morning nurse that them patient they want, and you want to reach before the examiner, the patients that you want for exam, and make sure so you go and clean them and tidy them, or ask somebody to do them. Make sure so they look nice and prepared. Make sure so them bedside and everything freshen up and all of that. That's the first thing to do for exam day. The next, when the assessors come, they normally come ready. Volunteer yourself to go first. And I know not everybody will get a chance to do this, but our first come first serve. So I know you're anxious, I know you feel like you're not ready, but you are. Volunteer to go first. If they ask who's ready, me, it takes so much pressure off you, because while you're doing, when you're finished, do what you're, when you're finished, do your best in whatever skills. When you're finished, you're watching your other colleague, and while they're watching your other colleague, you get to finish up your care plans or whatever it is. You get to do as much, anything that you're scared for, prep for whatever comes next, right? The next tip, and I'm so sorry not everybody will be able to do this one as well, but I find it to be one of the most crucial point in span day, and it's something that I saw a UA student did, and I was like, why didn't I do this? Get your dressing done. Normally how the day goes is that they watch you do your assessment of one patient, a full head to toe, then you do your medication by the time 10 o'clock. So 9:30 to 10 they're about, 10:30 the latest, and then after that it's normal dressing. You know, visiting hours coming up, there's gonna be a whole lot of chaos on the ward. So what I saw this one UA person did, she did her dressing as her first skill before medication, and this was very awesome, because dressing is normally the one that takes so much time, and it's the one that basically has all the anxiety built up into it. So she did her dressing like right after her assessment. She did her dressing and got that out the way. Can you imagine how much burden off your back? Because you don't know, say you're good for medication administration and everything. And basically after that, she opted to serve the 2 o'clock meds, so she had a longer time to finish up the paperwork, which takes so much time. So if you can do that, try your best to do. If not, then it's fine. You still got this. I didn't do my dressing first, but I did my assessment first, and they only watched me do one assessment, and I chose a patient that I know I got it for, and stuff like that. So yeah. So for the dressing, things to remember when you're there, they need to see you clean the dressing trolley. Remember, it's one wipe per, so you're gonna need a whole reel of paper towel. It's one wipe. And remember that, so for when you're making your beans, get a red bag and a black bag. I didn't know that. So yeah, there's a whole lot of subjectivity when it comes down to dressing, and a lot of persons have reached out to me and I've told them the honest truth. It doesn't matter which style you do it, if it's UE style, NCU style, UTech style, lecture style, online style, because we see a lot of videos, we see a lot of persons out there doing seminars and stuff. As long as you maintain sterility, you are fine. As long as you can give rationale for what you did, you are fine. Again, the key term here, the key thing is that you maintain sterility. No matter if you see some students are going into this set without sterile gloves, it doesn't matter if you see some students putting the tape. There was a conflict in terms of putting the tape on the second trolley versus the lock. As long as you maintain sterility, you are fine. All right. And that's just one tip, because when I was in nursing school, my lecturer had taught me this technique where you can use in a sense where the gauze, by the time you open the set is a mess and you want to move stuff around, but you don't want to waste a glove to go in there. She taught me a thing where you can pull up your syringe, which is sterile, and use the needle part to fix in. I did that in my max span and my teacher was flabbergasted. And I had to reassure him that remember that I did my checks and this gauze and whatever is sterile, so therefore there's no contamination stuff there. I didn't try to do that in span because I don't know if but it was, yeah, you got the point. Anyways, the next, pay attention to the duration of the treatment chart. So getting a treatment chart up to date is one, and you find out that it is not expired, it is okay to use, but you did not check for the duration. How long should this medication be given? For 7 days. I have a case in real life now where I'm looking through my medication and my cardiacs, and I realized that this medication is supposed to be served for just 7 days. When I look at the signature and how much time this patient has been receiving this medication, it's more than 7 days. So pay attention to the duration. All right. For the dressing, back to the dressing, based on your assessment of the wound, and this is something that I did not get full marks for, I got marked down for this area. Make sure that you have enough solution. I did not do my estimation properly. So because I had a small wound, I poured like 100 cc in my dressing tray, and my lecturer was like, are you sure you want to do that? And you see, from they ask you that, it's a sign for you to reevaluate yourself. But I missed that cue, and I was like, yeah man, I'm gonna do my thing. So at the end of it, they were saying that the only thing that they would take away from me for the dressing was that I didn't put enough solution, and I could have choked myself for that. So be mindful of that as well. Do not use the big 60ml syringe that we always try for hide and teeth in our bag and carry for exam. Don't use that if you know you don't know how to do the whole pull thing without breaking sterility. The 50ml syringe, it is really hard. Even if you have a pink needle, it is really hard to pull. Some of them malfunction. So if I'm like gonna stick to the 20cc, yes, it takes a little time, but in terms of managing, if you know you're weak in your hand and you got touch where enough to touch, leave the 50ml syringe alone. Another tip is to tell the examiners beforehand that you will need assistance. So as them come and say, I'm going to need assistance to turn this patient or for someone to hold this patient. And this is where the UE students came in. They were there and they came and they held the patient for me, and they hold like part of the dressing, the pampers stuff. They were my real G's. I don't know which part they know in their life, but anyway on the day, big up on yourself. Stuff like that. I'm coming down, people. Remember to pre-cut your tape especially if you're gonna need something to hold the gauze in place when you're covering it. You know, so after you cover it, we just want to cover the wound, this is sterility done, but make sure you have at least one tape to cover it. There was a talk going around in terms of writing on the tape, in terms of dressing done on this date and you sign it. I don't know about that, honestly. I never see it nowhere on a rubric. Never see it anywhere in a book. I did it. Did I do it? I didn't do it on exam day and it was fine. But I know persons who did it. Honestly, I don't know about that. So you can ask about that. Remember, while dressing the wound or when you're uncovering the wound, that is your time. Right before you dress it, or before when you're doing your assessment, that is your time to speak to the examiner about the wound in terms of description. Tell them the location, the size, how you see it, how it presents, if there's any exudate, is there healthy tissue, is it necrotic, stuff like that. And don't gonna, if you know say you know the word them, you can't remember everything, don't bother it. Don't bother. Do the talk where you know. Make them ask you. Don't say something unless you're sure. Yeah. During the procedure, of course, you're gonna talk to the patient. Let's say, okay, miss or sir, I'm gonna start the dressing now. If there's any pain or discomfort, feel free to let me know. I ask the patient, are you okay? Stuff like that. Not that you're gonna talk over the wound, but yeah, you get the gist. For medication administration, always remember to ask about allergies. Ensure say them swallow, if it's a pill, ensure that they swallow the medication. Ask them to open their mouth. Remember the 3 checks, but it's kind of like a 4 check. You know your 3 checks, but you see the first check, that is known as verification, which means you'd verify with the treatment chart and stuff like that to see if it's viable in terms of like the duration, if it's expired, stuff like that. Yeah, so it's still kind of like 4 checks. All right. If there's anything abnormal, report it to the nurse. I mentioned that before. So for example, if you're giving the Digoxin and you're gonna take the apical pulse, you're gonna have to do that, because if it's low, you cannot serve the Digoxin. The Digoxin is gonna lower it even further. So if you do that and you get a low reading, you're gonna say to the examiner, the apical pulse is so and so. I'm gonna let the nurse know this is an asterisk point. Are you gonna say, because it is so low, I'm not gonna serve this medication right now, stuff like that. Okay. Of course, when you're giving the medication or before, you're gonna educate the patient on why they're getting it, signs and symptoms, and don't bother. I went through nursing school luckily as a scapegoat with just saying nausea and vomiting is something. I made a TikTok about it and people think I joke, but that's all I said in nursing school. But what you can do is think about why the patient is getting the medication. So if I'm getting a medication because I have diarrhea, that means when I take this medication is going to stop the poo from coming. So a side effect or adverse effect can be constipation. Yeah, that's one way to kind of think about these signs and symptoms. Not signs and symptoms, I mean effects, side effects. Yeah. So yeah. After that, now they're gonna give you a little time to basically finish writing up your care plans, collecting your information, and putting things together for, you know, the questioning part. So you're gonna get a little time and you're gonna call it in one by one. In nursing school, I always have this fuss by saying, not all the time a patient has 3 diagnoses. That's why I don't know if it choose to stay with patient them. That's why I don't know if it choose them, because they are saying that you must can find 3 diagnoses, and not all the time. It is so unfair. You know, this nursing thing sometimes is so unfair. It is so unfair. Not all the time you can find 3 diagnoses for a patient, especially if they're on the more stable side. Because if you're saying that I must can find it, you're telling me that I must can forge up something and put on my care plan and say that my patient was bawling for pain. You're pushing me to lie. So anyways, ensure sound I don't want to do. So my question, I was interviewed by the same 3 persons So they asked me about the rights of medication administration. They asked me about the ethical principles. I studied it, but on the day I couldn't remember more than 5. And I thought they would have stopped at 5, make them 5 enough. Time I bust my brain to remember the 5, and she was like, what else? I'm like, honestly, I can't remember anymore. And then she told me, and then I said, oh yes, because with telling them what they are, you have to tell them how you use them today. So I tell them to use autonomy, where the patient had a right over them treatment and beneficence. I'm telling them say I always did what I'm supposed to do. I did good. I didn't do anything to harm the patient and stuff like that. They asked me about like the nursing theories, and I always use 2 of them. Florence Nightingale, which talks about, you know, the environmental cleanliness and stuff like that. I'm telling you, so the environment have to clean, the patient clean, the bed clean, the desk clean, the bedside thing clean, the floor clean, and that promotes healing. And I use Watson, which has the theory about caring. Some talk about, you know, as a nurse, so I care for the patient and stuff like that. And there's this other one, I don't remember, self-care, where it states that you don't do for the patient what they can do for themselves. Yeah, I think I used that sometime, but I don't remember who. They're gonna discuss your care plan. They're literally gonna go through it step by step. Why you chose this? Did you do this intervention that you wrote? I had a constipation care plan, and one of the intervention, honestly, I never do nothing for that. I never have the time, cause me put massage abdomen. The patient never have no medication in terms of laxative, and I wrote that I would advocate. I advocate nothing, because me even forgot to me say the patient. I mean, gone right gold medicine, because when I checked the patient diaper, he had stool, but it was small, you know, forceful same way, so gold never really met. But I think God kind of made them give me a blight in that aspect, because I knew what I was talking about. And that's the thing, is it confidence. All right, so before you write your intervention, please know why you write them and the rationale for them and stuff like that, because they're gonna ask you. So overall, if you did all of this and you still don't know what to do, there is always Miss Vaughn on Instagram. That's her niche. I went to her care plan class some time ago, I don't remember. Once I went, and I didn't go back after that, because what I got from that one session was, you know, it came with me for life. A lot of persons needed a little more sessions, so my advice was to go on her website, check out some of the things that she has to offer. I think she has summer class, she has span prep, she has a lot of things, dressing, data sheet, you know, the first page that you fill out information for the patient, she has that as well. So anything that you think that you really need help with, go check it out. Yes, it costs money, but we want to pass. A lot of persons ask me how to get good at dressing, how to get good at this. There's no other answer but practice. If there was a pill around that you could take to know something, best believe I would have that pill already injected, swallowed. I would have already had it, so I would even have none to take. The only way to get good at it is to practice. So I know this video was long, and I do hope that you took away something from it. Don't forget God. He is the head cornerstone. He's the one that's gonna take you through. So don't forget him. Start your day with him, go through your day with him, and end your day with him, and you'll be fine. Help your friends, help your colleagues, be kind, and just put your best foot forward. And if you reach the point where you say you're still not ready and you don't know what to do, it's best you just go and try, because you can, even fail, you can try again. And if you don't do it, you still have to go wait until the next sitting to do it. So why not do it and fail? Yeah, you might not fail, but I hope you guys took away something from this video. If you have any specific question as it relates to span, feel free to comment. A lot of you guys have my number. I prefer Instagram. So yeah, I'm still trying to clear up my Instagram messages. It's a bit bulky, but I'm still going through them. And once I see them, I open them, I'm gonna respond. Thanks you guys so much again for watching. Don't forget to like, share, comment, and subscribe. Don't forget that I am rooting for you. And I'll see you guys in the next video. See you guys when you are preparing for your RER exam. Now, if you watch this video and you pass span, please remember to come back and comment, because I really want to hear of your success story. I want to see someone want to come out, come help me in the workforce before we kind of dip, you see it. Thanks again so much for watching. Don't forget to like, share, comment, and subscribe.